My client injured her low back about 10 days ago lifting a laundry basket, and she thinks that she probably twisted when she did that. And she reports pain overlying the sacrum. You want to point to where your pain is?
It's actually more, it's kind of like
That's your sacrum.
Yeah, right on my sacrum.
Yep.
Like attachment-wise, not, and it doesn't feel joint. It just feels very mechanical.
Alrighty. And you had one chiropractic treatment?
Correct.
Okay. I'm looking at the ILA, the angle at the inferior lateral angle of the sacrum, and yours is symmetrical. And I'm going to spring it superiorly, and I can load it and spring it on the left, and then the same thing on the right. I'm going to then divide the sacrum into 4 quadrants. So here's her lower quadrant on the left, and I can load and spring it. And I see her feet move, so the force translates through the SI into the hips, into the lower extremity. And I'm doing upper quadrant, and that moves nicely. Okay? Now, when she sits, we see a different picture.
Oh, did I move?
You're fine.
Okay.
So when she sits, it puts her spine and pelvis in a little bit of flexion. Then I isolate the PSISs, posterior superior iliac spine of the ilium. Yep. And then we come up a thumb width and in, and this would put us at the upper part of the sacrum called the sacral base because it's wider. And this is at S1. And I can thrust with my thumb and induce motion going through that structure. Okay? And then when we come down to the lower part of the sacrum, it's very apparent to me from my perspective. I know the camera's at an angle, but if I slide my thumbs together, my left thumb overrides the right thumb by at least 3/16 of an inch. So this lower part of the sacrum is prominent. And when I spring on the right, her whole body moves. The force translates through. And I'm going to apply the same amount of force. I'm going to double that force, or even more, and there's no movement. There's no translation through her left sacroiliac and lumbosacral joints. Okay? The other thing I started doing, and this is my main purpose in posting this video, is that with a sacral torsion, there's also a side bending component. I don't treat the side bending directly because once I correct the rotational element, the side bending always corrects, and I always retest that. But I'm going to take my thumbs underneath the sacrum, underneath the ILA, and I can see that my left thumb is lower. I don't think the camera angle can see that, but more important than how something looks is how it moves. We're treating a movement dysfunction, and I lift up, and her whole body moves easily on the right side. On the left side, there's this significant restriction. Can you feel the amount of force I'm applying?
Yes.
How much force am I applying?
More than even on the right, and I can definitely feel it stuck.
Yeah. So there's no motion translation with that test. And there's a number of ways of treating sacral torsion. I wrote a book chapter called Sacral Torsion. I think the subtitle is A New Approach to an Old Problem. And it's in Eric Dalton's book, Dynamic Body. And in that book chapter, I have people lean against the wall and place the foam up against the lower sacrum. So I have them identify the tailbone, lifting up in the midline crease of the bum. And then I have them lean against the wall with feet as wide as their shoulders, heels about 4 inches forward. And they just bend back and forth, touch the wall with their shoulder blades, and then they bend forward with their nose going in front of their toes. So nose in front of toes is the mantra. And 10 of those is very effective. So let's have you do that. Okay, so take that with you. And this makes clients independent in managing sacral torsion. And once corrected, this is a very, very easy way to maintain that benefit. And this is also a very good general back pain prevention exercise. So let me get my zoom up. So your feet are wide as your shoulders. Your feet are about 4 inches forward, okay? And then you bend forward, nose in front of toes. Nice. Beautiful. Give me 10 of those. And forever do 10 of these a day.
I have been, intermittently doing these, but not forever.
Yeah.
And daily.
Oh,
You're not feeling necessarily a lot of pressure back here, right? Just
no.
enough.
It's not much pressure. Maybe I should develop a phone app to remind you to do them.
Yeah. When you get your cup of coffee, do your...
There you go.
While it's brewing.
There you go.
I think that's about 10. I wasn't really...
Beautiful. What kind of coffee are you drinking these days?
I have a fancy... trying to get away from those K-cups.
Yeah, they're expensive.
Yeah.
Aren't they like 75 cents each?
Yeah, it just feels like, we don't need to put more plastic
There
in
you
the
go.
landfill.
Good. Come and sit.
So just good espresso.
Uh-huh. Yeah. I hang with two kinds. I'm from New Mexico, and so I buy pine nut coffee from Costco.
Oh, that's
Yeah.
a brand.
Yeah, New Mexico Pinon nut.
Yum.
And then I'll alternate with Boyer's, a local roaster, Denver roaster. Their Kona blend is wonderful, and that's found at Walmart.
Really?
On the bottom
I
shelf.
like Kona blends.
Yeah, it's wonderful. And I've had the full Kona, and to me this is just as good.
Okay.
Yeah. So anyway, it's $15 for 2 pounds at Walmart, and at the big grocery store it's $20. So here's left lower quadrant, and now I can easily thrust that, and there's good mobility. And I've tested lumbosacral motion coupling after correcting a torsion, and I find that motion is normal. I'm going to come underneath the ILA now, and they look symmetrical, and now I can easily lift up through the sacrum. So you presented, which in my terminology, I name it left lower sacral quadrant prominent and stuck. And I like that terminology better than the old model. It tells you where it is positionally and which way it doesn't move, so you know what the treatment should be. The traditional terminology would call that a left sacral rotation about the left oblique axis. And I find that one, especially when it's like left rotation on a right oblique axis, it gets confusing because you have to remember which way does the axis go. In this example, the left axis starts at the top. But it takes more visualization. I always have to stop and really think it out when I use that terminology. So anyway, again, the main point of this video was just to show that recently I've started that upward side bending force through the sacrum when finding somebody with a sacral torsion. And now you know your homework, so give me a lot of money because I probably won't see you for a long time.
Good.